Me, for instance, I'm a guy. Let's say I want muscles. What do you think I'm supposed to do?
Maybe you go to the gym.
Go to the gym. So if you want ass, go and do ass workouts in the gym. Why should you go for a BBL? It will take time. Kabema na koye ne nsana nka ogu ye dia.
And I mean, you are down for yesterday or gym fan. That's all the experience.
Hello viewers, welcome to Avaskate podcast. This is another episode, and today I'm here with a beautiful and a nice, elegant lady, and she goes by the name Prissy. Hello Prissy.
Hello.
What's up?
Cool.
Okay, she seems to be having a cool time here. So, do you have anything to say to our viewers?
Yeah, please subscribe to our YouTube channel.
Okay, thank you, Prissy. So today, we want to address one issue. There is something trending on the internet about a girl who went to do some BBL despite the body spec that she's having. And I think she goes by the name what? What's her name?
I think her name is Elena.
Yes. Elena. I think Elena Jessica. So, Elena Jessica went to do a BBL, and through the BBL she died. So what do you have to say about this? What do you think about her idea to do the BBL in the first place?
Well, it's her fault some way, and some way it's not her fault.
How?
Because allegedly, per the information that I got from social media, she initially went to a hospital, and they rejected her. They couldn't perform on her, and then another hospital accepted to perform on her. So I think the hospital is also at fault.
Yeah, you have a point. But what is this thing? Why is it that most women, even women that have high body specs, as in ranked by men, we say that these women are very curvy. Still, this woman wants a BBL. Why? What's in the BBL?
No, maybe for me, you think she's scary, but maybe in her DMs, people have been body shaming her.
Body shaming her? Yeah. Have you seen her original picture?
No.
Then I think you need to see it. Because this girl, it's not like maybe she's slim like Chingalingyo. No. Like she has that curves that 90% of every guy will like it. And so what's her problem? I don't know.
Well, I don't think she did it for any guy. Maybe she wanted to do it for herself.
For herself?
Someone improving how she looks like does not necessarily mean she's doing it for a guy.
Oh, okay, I get you.
Maybe she's doing it to boost her confidence.
To boost her confidence as in what way?
Some people are curvy and all that and still are not confident in their bodies.
Confident as in you are trying to say that maybe the type of guys that comes into her DM makes her not pick.
You never know what someone is going through.
What is she going through?
Maybe some people go to their.
So what are you going through?
No, because I don't have the money.
So if I dash you the money right now, will you go and do it?
No.
So why are you saying that she's not confident and stuff?
Because I'm proud of my body. I'm content with what I have.
So from what you are saying, the girl is supposed to be content with what she has. So why she's going around hospitals?
But it's her money. She's not the only one who has done it too, because she died as a result of it. That's why everyone is talking about her. But she's not the only one who has done it. Yeah,
you have a point. She's not the only one who has. But I think from information sources, she's the only one that I've heard that why the first one away, then she goes to do the second one.
So sometimes it's in Korea, in social media, it's maybe so very in the and back and about so same back. So we are now so we are showing no, and maybe no pen on your man. Into also fix it.
Okay. But still I think I don't know what's wrong with her.
So according to you think it is the girl's fault?
Yes, it's her fault.
It's entirely her fault.
Yes, you know why? First, you went to a hospital and the professional doctors, being so professional, they inform you that no, the surface of your skin is too thin for them to introduce extra fat into it.
Professional doctors.
Yes, professional doctors.
So are you trying to say the other hospital they are unprofessional because they performed the surgery on her even though they knew the risk?
Yeah, I once saw a video online and the doctor was kind of saying that when you come to hospital, they are not interested in you getting well, they are interested in their funds. I know maybe some doctors may not carry that mentality, but it was a video I saw online, and in this video the doctor was saying something like there was a guy who had cancer and the guy came to the hospital and the doctors pronounced him that maybe in about 4 to 6 months time he will be dying. And this guy, he went home knowing that he has nothing to counter what the doctor said. You know what he did? He started fasting. He fasted for close to 30 days. And by virtue of the fasting, his gut, his alimentary canal was denied food for some time. Maybe like a day. He fasted for like 12 hours consistently for almost 30 days. And by virtue of that, after 3 months, when he went to the hospital, he was cured. So the doctor was trying to get our attention that sometimes it's not everything that is it's not everything that you require medicine. You get it. Even he was saying that even some medicines are like they cause extreme damage to your kidneys and the liver and some other parts. So which means the doctors, they know the dark secret behind the medicine, but still because of marketing and fancy, they go ahead to what prescribe. They know that certain prescriptions when they give to you, you will never get well, but they will give it to you.
Yeah, I get it. So it's not entirely her fault because you don't know what the other hospital, the second hospital told her. You don't know what transpired between them. Maybe they told her that they could fix it. You don't know what happened.
What's the name of the other hospital? I think Sinoja or
And allegedly there have been complaints about that particular clinic that like failed surgeries and stuff.
go to CAT and see. You will see the amount of failed surgeries there. Every hospital has flaws. It's because she went there and died. That's why they are bringing out all those information. But the other hospital that rejected it, go and find their records. You see the number of people they've made to die.
Okay, fine, they rejected her. So why didn't the second hospital to reject her?
Why did the second hospital?
Why didn't the second hospital to reject her?
That's what I'm trying to tell you here, that it's not all the time that you see. Sometimes it's due to market. Maybe you brought about 1 million naira, 1 million naira on the board and 1 million naira. Do you think they watch the money go like that?
What is that trying to say?
They knew the implications, but because of the money, they allowed her to come and say that they had the surgery on her.
Yeah.
So it's not entirely their fault. They could have been prevented if they had said no.
Nah, don't you know that behind every fruit there was a seed? You know that. So her seed was her greed. When you talk a say natural, God gave it to you right from your mother's womb. First one, you weren't happy about it, and second one, fine, you've done it and it was successful. Also made the answer me. I want more of the fried rice, more jollof. So by you doing this now you die. So when you go and meet Jesus Christ there, what will you tell Jesus?
So is your problem the fact that she did the BBL or she went for a second round? I don't get it.
My problem is that she went for the first, the second two is my problem. All of it is my problem. So I want to ask you a question. So will you do that surgery?
No.
You won't do it.
Yeah,
Why?
because I'm scared to die.
You are scared to die.
Yes. And I don't even have the money for that surgery.
Okay, let's say this case hasn't emerged. Would you do it?
No.
No. You say you don't have the money. So if you had the money, would you do it?
No.
Why?
There are so many things that even if I had money, I wouldn't do it.
Like what?
Like the BBL.
And what?
And what? Like tattoo, piercings on the stomach and stuff like that. Even if I had the money, I won't do it. But people do it and it's nice to me. Like when I see them, it's nice. But personally, I wouldn't do it.
Oh, okay.
I have my own.
They also have their own reasons. Yeah.
Oh, I get you. But from this BBL thing, why is it that majority of women, they want to do it? Mostly when they get fame. When the fame comes and the attention comes, they want to do BBL. For instance, I think Medical's ex-wife, when they splitted, cases emerged that she did a BBL. And I remember her natural body too, it was correct. As the men will say, as we regard bodies, it was very nice, but she still went ahead to do it.
What I'm saying, she's doing it to boost her own confidence.
What confidence? What type of confidence? So which means initially she didn't have confidence or what? Or she was afraid when she was walking.
Not everyone does the BBL thing for men.
But for who?
So you think when someone dresses nice, when a lady dresses nice and steps out, she's dressing to attract men.
Yes, it's obvious. She's dressing to attract men.
So don't you dress to go out?
Yes.
You dress to attract ladies.
Yes.
The fact that you dress to attract ladies, that don't mean say the ladies too dress to attract men.
So why do you think it's not the girl's fault entirely?
Because I think the second hospital, they have the expertise to determine whether.
Why are you saying the second hospital? The second? Why the second hospital? The first hospital rejected her. So why do you think the first hospital rejected her?
Because they
knew the implications.
Because they know it. So if they have rejected you, go home and sleep. Huh?
Okay, like,
Or don't you get what you are saying?
That's what I'm trying to say, but still, it's not entirely her fault.
You are still saying
She's
it.
supposed to be blamed, but it's not entirely.
It's entirely her fault. Like where on earth is basically like, why should you develop like the mentality like you want an extra, like me for instance, I'm a guy, let's say I want muscles. What do you think I'm supposed to do?
Maybe you go to the gym.
Go to the gym. So if you want ass, go and do ass workouts in the gym. Why should you go for a BBL? It will take time.
yeah.
Kabema na koye ne nsa na nka owu yi.
And I mean, you are for yesterday or gym and it's only the eternity.
Because maybe she's not doing it the right way. You get it? There are some specific workouts that when you do, it targets the muscles on your butt, and it will increase it as a matter of time. As time goes by, it will increase it. So, what are you trying to say? As for men, if it was we there, we should go to work out, but the girl there, she should perform a BBL.
Yeah.
It's her money.
It's her money.
You can go for injections.
Injections to what?
It's her money.
It's her money now, or the shirt 6 feet now. So the money, will she carry the money along? No. So when you are doing anything, know that there is a principle. One basic principle that exists on the surface of this earth is that every action has what? Consequences. So when you are doing that, even those who have successful BBLs, you know what they are going to go through maybe at their old age. If you're being 70 years, you don't know.
No, just say only the almost signing consent form.
Yes, they do.
Oh, yeah,
Yes, so every action has consequences.
Yes, you pay the consequences.
Yes, you won't go scot free. You face it. Mpanimfoɔ na kaa sɛ biribi na ɛyɛ biribi ma biribi bɛyɛ biribi ɛnyɛ biribi na ɛyɛ biribi anka biribi ntumi mbɛyɛ den mbɛyɛ biribi nti no ɔno na n'ani bereeɛ in the first place. Her greed for more ass, more watery ass, that's the first problem. And she went to do the first one successful, and the second problem, you went to the hospital, they say no, your skin is too thin, the skin covering the fat is too thin, so if you do it, it will stretch. They told you what will happen when you do it, and you didn't listen, and you went ahead to do it. Now try a pacha, that one, what do you expect us to do?
So Abami Beni Franke, successful
cry. You see that she will be on the bed, and when the guy is behind her, you see that then it will split all over the place.
How sure are you?
How sure am I? But they said it at the first hospital. They said it. So once they said it, nice girl. Have you seen her picture? She's very beautiful. Nice girl. I think she has a twin. Yeah, a sister. They are twins. Now, her sister was blaming the hospital that it's their fault.
Yeah.
Meanwhile, you know that she went to the first hospital, which is popular. Maybe I wouldn't and you went there and they said.
So are you trying to say the second hospital is not at fault?
They are not at fault.
Like they are not at fault.
Not at fault. Let me create a scenario for you. Let's say me, I'm a professional doctor in cath, and there's another doctor too in Menchia Hospital. So Menchia Hospital and Cath Hospital, which one do you think is the best relatively?
I've not been to any of these two hospitals.
But maybe from what you've heard in your ears, Konfanochi Teaching Hospital and Menchia Hospital, what do you think is the best?
Don't know. You don't know. Honestly, I don't know.
Okay, you are an Accra based, right? Okay, let's say one private hospital in Accra and 37 military hospital. Which one is the best?
A private hospital.
A private hospital.
Yeah.
How sure are you?
Private hospital, because these government hospitals, you can even go there and with an emergency and be like, we don't have beds.
You are not being realistic. You are saying like you are deviating from what I'm trying to like.
What are you trying?
You know what you are saying. You are bringing the worst case scenario, but I'm talking about the best case scenario,
Which is
when there are available beds, doctors, everything. The best case in both hospitals. Which one is the best?
So
do you think private hospitals have unqualified doctors?
No, I'm not saying they have unqualified, but even sometimes it's the government hospitals that they use their money, their capital to establish a private hospital. I'm not saying they have unqualified, but as compared, relative, the best case scenario.
Yeah, I would opt for the private hospital.
Not your perception, the reality.